Good morning. I'm Michelle Levander, Director of the USC Annenberg Center for Health Journalism. Thanks for joining us today for our Health Matters webinar, Clinton versus Trump, the Future of U.S. Healthcare, offered thanks to a generous grant from the National Institute of Healthcare Management Foundation. In this election, voters will choose between candidates with two starkly different plans for Obamacare, expansion and fixes, or repeal and replace. Yet until recently, Obamacare was barely discussed on the campaign trail, prompting hand-wringing editorials. But with news of dramatic rate hikes in 2017, Donald Trump has put Obamacare center stage, saying recently that this election is going to be about Obamacare. In this webinar, we'll take that as our point of departure and try to help participants understand how these fundamentally different visions will play out, depending on whether Secretary Hillary Clinton or Donald Trump is elected, and political realities in Washington. Here to help us get past all the campaign rhetoric, we'll hear from Sarah Collins, Vice President of the Healthcare Coverage and Access Program at the nonpartisan Commonwealth Fund, Jennifer Haberkorn, Senior Healthcare Reporter for Politico and a former National Fellow with our Center for Health Journalism, and Diana Furchtgott-Roth, a Senior Fellow at the Manhattan Institute, Director of the Institute's Economics 21 program, and a volunteer advisor to the Trump campaign. Before we get started, I wanted to share some details on our format. First, we'll hear from our three panelists, and then we'll take your questions. We have more than 200 people signed up for this webinar, so we'll ask you to raise a virtual hand on your webinar dashboard and share your questions through the chat or question box. If you have technical problems, you can also use the question or chat box on your control panel. Should you want to tweet about this webinar, we'll be using the hashtag HealthDebate16, and we invite you to add to the conversation. We'll also be recording and archiving the webinar. Sarah, let's start with you. The Commonwealth Fund just published its analysis of what a Clinton or Trump plan would mean for Americans and their pocketbooks. Take us through some of your findings.
Thank you, Michelle, and hello, everyone. I want to thank the Center for Health Journalism for inviting me to participate this morning. The Commonwealth Fund, as Michelle mentioned, is a nonpartisan independent foundation that supports research on improving the U.S. health system. As part of the fund's ongoing work to help the public understand how public policy affects our healthcare system, we awarded a grant to the RAND Corporation to use their microsimulation model known as Compare to model various healthcare proposals of Hillary Clinton and Donald Trump. The goal of this work is to provide an unbiased evidence base to inform policy decisions. RAND's model can estimate the potential effects of policy options on health insurance coverage, consumer out-of-pocket costs, and the federal deficit. Christine Eibner, an economist, directs RAND's modeling work and is the lead of both fund reports on the Clinton and Trump proposals. I'm going to provide a brief summary of those findings today. Hillary Clinton and Donald Trump proposed starkly different approaches to improving the U.S. healthcare system. The proposals have very different potential outcomes for consumers. Clinton proposes to maintain and build on the Affordable Care Act. On balance, her proposals would lead to fewer uninsured people, lower out-of-pocket costs for consumers, and some proposals would require new federal spending. In contrast, Trump proposes to repeal and replace the Affordable Care Act. On balance, his proposals would lead to more uninsured people, higher out-of-pocket costs, and new federal spending. The next three slides show the full set of healthcare proposals of the candidates. The Commonwealth Fund created an interactive feature on our website that includes all the proposals, and I invite you to explore that. We limited the information to what both candidates have posted on their websites. The provisions in red indicate those provisions that RAND modeled. As you can see, RAND modeled only a subset of those provisions. These were provisions that we had sufficient detail about to make modeling possible and for which RAND had the technical capacity to model. For purposes of brevity, I'm mostly going to limit my comments to those proposals that RAND modeled. As a starting point, Clinton would maintain the Affordable Care Act and Trump would repeal it. Clinton proposes to help stabilize the marketplaces by adding competition and choice for consumers through the addition of a publicly administered insurance option. Trump would replace the reforms of the individual market under the Affordable Care Act with the ability of insurance companies to sell products across state lines. On Medicaid, Clinton would provide 100% federal financing to the 19 states that haven't yet expanded Medicaid for 3 years. Trump would repeal the Medicaid expansion and finance Medicaid through block grants to states. Both candidates seek to improve the affordability of health insurance and health care. Clinton would increase the generosity of tax credits for people buying coverage through the marketplaces. She would also fix the family coverage glitch that prevents people with high family premium costs in employer plans from becoming eligible for tax credits through the marketplaces. As a replacement for the ACA marketplace subsidies, Trump would make premiums for individual market coverage tax deductible. Finally, Clinton would provide tax credits of up to $2,500 for an individual and $5,000 for a family for both premium and out-of-pocket costs that exceed 5% of someone's income. This is for people enrolled in either individual market policies or employer policies. RAND estimates that compared to maintaining the Affordable Care Act, repealing the law would lead to about 20 million fewer people with health insurance. A repeal of the ACA's individual market regulations and consumer protections, along with subsidies, would lead to an increase in average premium and out-of-pocket costs for people who buy coverage on their own. And a repeal of the law would also increase the federal deficit. This is because the loss of savings from the law's Medicare reforms, such as reduced payments to doctors and hospitals, and revenues from fees and taxes, would be greater than savings from the elimination of the insurance subsidies and the Medicaid expansion. In terms of the 4 Clinton proposals that Rand modeled, the tax credit for high out-of-pocket costs leads to an increase in health insurance coverage of 9.6 million people. The other proposals that Rand modeled would have smaller effects on coverage since they are more targeted. A caveat here is that Rand modeled the cost-sharing tax credit as if everyone with high spending would get the full credit, but it is very likely that such a program would be structured so that not everyone with spending over 5% of income would be eligible for the full credit. So this should be viewed as an upper bound estimate. Each of Clinton's proposals would reduce out-of-pocket spending on health care relative to the Affordable Care Act. The cost-sharing credit would have the broadest impact affecting people in employer plans and the individual market. People with low and moderate incomes would see the greatest benefits from these proposals. 3 of Clinton's proposals would increase the federal deficit, with the largest increase associated with the cost-sharing tax credits. Again, Rand modeled this as if everyone receives the credit, so this is an upper bound estimate. Adding a public option would slightly decrease the deficit. This is because adding the plan would lower premiums in some markets due to increased competition, and because the plan itself would be cheaper than private plans, leading to lower federal spending on the premium tax credits. In terms of the Trump proposals that Rand modeled, a repeal of the law would lead to about 19.7 million fewer people with health insurance. Trump's replacements, the ability to deduct costs of individual market coverage and allowing insurers to sell across state lines, would only marginally offset those losses. His proposal to block grant Medicaid would lead to additional coverage losses compared to repeal. Each of Trump's proposals would result in higher out-of-pocket costs on average for people buying coverage in the individual market. If you think about the world prior to the Affordable Care Act, states set their own regulations for the individual market, such as allowing insurers to charge premiums and deny insurance on the basis of people's health status. In that world, if insurance carriers could choose the state from which they would sell policies, they would likely sell from states with the fewest consumer protections, for example, those that allow rating and denial based on health. This means that the greatest benefits of such a policy would go to healthy people, while many people in poor health would lose coverage or see higher costs relative to those in better health. The tax deduction that Trump is proposing as a replacement for the premium tax credits people receive now in the marketplaces would provide the biggest benefits to higher income families. By definition, people with higher incomes can take larger deductions. If you look at the column on the left, for a family of 4, the amount of the Affordable Care Act's tax credits fall with income, benefiting low-income families the most. If you look at the column on the right, Trump's tax deduction rises with income, benefiting higher income families the most. As I mentioned, a repeal of the law leads to an increase in the federal deficit. The tax deduction would add to that increase due to the federal cost of the deduction. Block granting Medicaid would almost fully offset the deficit increase triggered by repeal, since it reduces federal Medicaid spending. Just to summarize, Clinton's health care proposals would provide insurance to millions more people than would Donald Trump's proposals. Clinton's proposals maintain the progressivity of the ACA subsidies while providing some savings to people across the income spectrum. Trump's proposals make insurance coverage in the individual market more expensive on average. His proposals yield greater benefits to people in better health or with higher incomes. 3 of Clinton's proposals would increase the federal deficit. Offering a public insurance plan would slightly decrease the deficit. Trump's repeal of the Affordable Care Act would increase the federal deficit. The candidates have promised to offset any new federal spending with other savings and revenues. And I'll stop there, and I'll turn this back over to Michelle and look forward to your questions. Thank you.
Thank you so much, Sarah. Jennifer, each candidate has a game plan, as Sarah has so clearly laid out for us, and they couldn't be more different. But what happens when Washington politics intervene with the best laid plans, and how will you report on these developments?
Hi, guys. Sorry, I'm just backing up my PowerPoint. So I guess my job here, I feel like, is to kind of throw a little cold water on the grand plans that the candidates have laid out, because, you know, obviously this is not just healthcare, but any campaign makes a lot of big promises on what they are going to do, and then they hit the reality of Washington, where, you know, politics doesn't always work in their favor, and, you know, either Hillary Clinton or Donald Trump is going to have a lot of that to deal with in terms of healthcare. So I thought I was going to start out with just a little bit on what healthcare next year is going to look like under either president and some of the dynamics that they're going to have to work with. So we know that the ACA markets, the exchanges, are in need of a lot of work. You know, whether you're a Republican or Democrat, you know, both sides say that these need work. If you're a Republican, you say that they should be repealed and replaced. If you're a Democrat, you say that these need to be shored up quite a bit so that they're sustainable in the long term. There's also a lot of public pressure building for something to be done on drug prices, and both candidates have spoken about this, and Hillary Clinton has put together some proposals, but there's a lot of pressure there from the public, and I feel like that's something that either party is going to feel like they need to address, or at least send some messages about next year. The Children's Health Insurance Program needs to be reauthorized, or else it'll expire in September. And I'm including that on here because that will be a piece of must-pass legislation, meaning Congress needs to do this. No one wants to end the CHIP program. So it could be an opening for something to change on health care next year. Also, the Cadillac tax. It has been delayed until 2020, but both parties really don't like this piece of the ACA. This is the tax on high-cost health insurance plans, and so that too might be an issue that could bring about some serious conversations on changes to Obamacare. And also the broader political dynamic. We know that the Senate is probably going to be very, very close, like a 50-50, 52-48 Senate, which will mean that everything needs to be get quite a few, you know, regardless of which party's in charge, you're going to have to get quite a few members of the opposite party to get anything done. And as of right now, it seems like Republicans will keep the House, but by a very small majority. And of course, that can change if, you know, in the days before the election, but as of right now, that's how it's looking. So under President Hillary Clinton, what we know right now is the ACA is here to stay for at least the next 4 years. You can make an argument that with this election, we're guaranteed that it sticks around forever, but with the ACA, we can't promise everything. We know that there will likely be a package of repairs to the ACA. Democrats will claim that there's a mandate to fix the law and that Republicans need to get on board. And if Republicans keep the House, we know that the Hill investigations into the ACA will continue, meaning that the administration will feel like they're under a lot of scrutiny to ensure that there aren't more, you could say, mistakes or problems with the law. I've put a couple of Hillary Clinton's healthcare proposals here. I won't go through all of them since it's been done already, but I want to focus mostly on the ACA repairs President Obama has laid out, which have been embraced by Hillary Clinton, and whether we'll see any of those get through the Congress. He's asked for a public option or a public option fallback. This would add competition, particularly in the parts of the country where there aren't a lot of insurers getting on the exchanges. Democrats argue that a public option would add a new level of competition, force insurers to lower their rates, and it would address some of these affordability concerns that we've heard so much about. He also wants more subsidies, which would be very costly to the Congress if that were to pass. And he wants to incentivize states to do Medicaid expansion. And I guess, you know, all of these are really big asks. And if Hillary Clinton is elected and she decides to put her political capital behind trying to get these through the Congress, it's going to be a pretty big deal. And I think the interesting thing will be, you know, does she try to make a deal with Paul Ryan, who will presumably be the House Speaker, and say, you know, if you help me fix the ACA, I'll work with you on tax reform or something like that. And, you know, my thinking right now is that it's going to have to be a really big ask, a really big offer to Republicans to get them to repair this law that, you know, they feel like was passed without any Republican support, without any Republican consultation, and now, you know, that Republicans control at least one house of Congress, they're asking them to save their law. So I guess if I'm handicapping, you know, major fix to the ACA right now, it seems pretty negative. But it's possible that the Clinton administration pursues technical fixes, small things that could kind of, not something big and flashy and controversial like a public option, but things like the risk corridors, things that are pretty wonky but would help shore up the legislation in terms of what Democrats view. And I think kind of underscoring all that is Democrats have always underestimated how much Republicans don't like the ACA. And I think if Clinton is elected, after the election, we're going to hear a lot of how Republicans need to change their tune on the law. And I just think there's no reason for Republicans to do that at this point. And I think that's going to underscore any kind of conversation about how to move forward. And so if Donald Trump wins, what we know, some of the dynamics, and again, I'm laying out these dynamics because I think they might be some good story ideas, or at least starting places of stories. So we know, basically, if Trump wins, all of Obamacare is reopened. I would put the law's future in serious doubt, but the real issue is going to be whether Republicans have control of the Senate. And I included a link here to a story I did a couple months ago that kind of lays out whether the law could be repealed if Republicans control Congress and the presidency. Because it's kind of technical, but the bottom line is if Republicans control Congress and they control the White House, they can take some big chunks of the ACA out, including the mandates and the exchanges. So that would be a lot of damage to the ACA in terms of how Democrats would view it. I think we would see the industry lobby really hard to keep the law in place because from their business perspective, they view this as consistency and they just want the law there because they know how to deal with it at this point. I think even insurers who are frustrated with the law don't want the uncertainty that would come about with repeal and then eventually replace. I think, Donald Trump has said that he would sign repeal of Obamacare, but I think we would see House Republicans drive the political pressure to repeal and replace. In particular, Paul Ryan's Better Way plan, which is not legislative text, but it's a general outline of how Republicans would replace the ACA. I would say that's another good starting point for some story ideas. If Trump were to win, that would be, and that is how I view the blueprint right now, because Trump has not laid out very, very specific proposals. But Paul Ryan is very specific in the Better Way roadmap. And I think we'd also see some regulatory flexibility added to the ACA in a Trump administration, particularly how states can do Medicaid expansion. And I think that'd be something interesting in terms of story ideas. If you're in a state that has not expanded Medicaid and maybe has a Republican governor who's somewhat interested in it, I think you'd see the Trump administration go as far as they can in the regulatory realm in terms of what they approve to give states as much flexibility as possible. So again, I've included the link here to Trump's healthcare proposals, and it won't go through them all again, but I think there are some good story ideas here. I think even just talking to some folks who are on ACA plans right now would be kind of interesting. But again, I would really look more to Paul Ryan's Better Way agenda, and there's a link in there, before going through what's on Trump's website, just because I feel like it's going to really be driven by the Congress. And I want to just mention a couple story ideas. I know I mentioned them throughout, but I think Medicaid expansion, again, is going to be really interesting in the states that have not expanded. If there's a Clinton administration, I think we're going to see her try really hard to kind of reset the clock in states where there's a Republican governor who wants to do Medicaid. Maybe the legislature isn't on board. I think the Clinton administration is going to want some kind of healthcare wins on the board for their own administration. I think they're going to work really hard with those states that are on the fence to do something. And I think there's going to be a lot of focus next year on affordability in ACA plans and on drug price affordability more broadly. We're seeing that already just with these prices that were released last week. A lot of people, even if they like having insurance, feel like it's not affordable under the ACA, and that's going to be something that Clinton is going to have to deal with. I mean, she says she's willing to defend the ACA, but this is a huge problem, and of course Donald Trump would repeal the ACA if he has the authority to do so. So this affordability question is going to be really important. I'd also look at kind of what's going on below the surface there. I mean, I think you can frame a really good story talking to some consumers as, this is the biggest, perhaps one of the biggest problems facing the ACA that Hillary Clinton has pledged to repair. And so I think that might be an interesting story. Also, Cadillac tax, just because Clinton has indicated that she wants to get rid of it, Republicans obviously don't like it either. The Cadillac tax, large employers and unions really don't like it. So I guess how concerned are local large employers and unions that this Cadillac tax isn't going away? And I think on the Democratic side, again, if Hillary Clinton's elected, I think the politics of some of these fixes that she wants to do are really interesting. I think in some parts of the country, a public option is really unpopular, even if it might be good policy in theory to have another insurance company that would offer some choice. I think the politics would be really difficult. It got really trashed in 2009 as government-run healthcare. And so I guess I wonder in parts of the country where there is low competition, have attitudes about a public option changed at all? And so with that, I think there's a lot of really good story ideas in 2017. Just the uncertainty around the ACA, is it opening for some good stories on how it's affecting people, and would love to answer any additional questions at the end.
Thank you so much, Jennifer. Lots of good ideas here, and I hope to hear more from you in the discussion. Diana, you've advised Donald Trump on his health plan, and you're very familiar with Paul Ryan's plan as well. We'd welcome your take on what might happen with the Trump and Ryan agendas with a win by either candidate.
All right. Well, thank you very much. Can all of you see my PowerPoint presentation okay? Is it showing?
Yes,
is my presentation showing up okay? All right. Okay.
Yes,
well,
that's
great.
showing up.
Okay. All right. Well, the main thing about the Affordable Care Act is how unpopular it is, and that is being we're seeing that again just this week as these different price increases have been shown by HHS. It's also very disappointing in terms of how many people have enrolled. The Congressional Budget Office estimated that there would be 24 million people enrolled this year, and it's only about 12 million people. People don't think that Obamacare is a good deal for them. There were many young people that were supposed to enroll, but they think it's too costly, and they are either paying no fine if they don't have enough income and staying unenrolled, or just paying the fine and staying unenrolled. So that's a major problem, because if you don't have the young people in the plan, then you get people who are mostly sick. That drives up the costs, and that's what we've been seeing. So here's a chart of the increases in the costs as published by the Department of Health and Human Services. The people in Indiana say that they don't think that their rates are going to go down by 3%. They see their rates as going up. So this is basically projected, and the story is just not good at all, as we can see. People in Montana, 44%, Tennessee, 63% increase, and we have all heard about what's going on in Arizona at the top end of the scale. Well, even when people have Obamacare, many of them don't think that they can use it. So here are the deductibles for the bronze plan, the silver plan, and the gold plan, and the platinum plan. As all of you know, the bronze plan is the least expensive, but you have to have deductibles of about $5,000 for a single person. Often it's about $10,000 to $12,000 for a family in order to be able to access that care. And that's not really true insurance, because your well visit comes free. You don't have to pay for the well visit of you or your children, and a few other things also, such as contraceptives. But these are all predictable expenses. You know that you're going to have to maybe go to the doctor for a checkup once a year. That's not something you need to be insured against. But under the Affordable Care Act, this is free. Yet, if you, say, get in a traffic accident or have a heart attack or fall off your bike in traffic, then you're stuck with costs of potentially $6,000 before you get to access what you need for the unpredictable element of insurance. And that flips insurance around. If you look at any other kind of insurance, life insurance, for example, you get to collect when you're dead, or your estate does. Home insurance, if a tree falls on your house, then you get to collect. You don't get to collect for example, changing the filters on your air conditioning system. That's a routine expenditure. You know you're going to have to do it, and you don't insure against it. The basic problem on why people don't like Obamacare is it's not really true insurance in the way that we are used to insurance. Well, let's look at the average number of qualified health plans available in each county. It's going steadily down, 30 in 2017 compared with 55 in 2015 and 51 when it started up. Why is this important? It's important because more plans mean more competition. When there's more competition, plans have to work to attract customers, and when there's less competition, then customers are left at the mercy of these different plans. Companies don't do anything because they are nice and kind. They do it because they want to get consumers away from the rival provider. And that's very important, especially when it comes to talking about Donald Trump's plan versus Hillary Clinton's plan. Again, the number of insurance companies offering plans in each county, that's going down also to 3 in 2017. Compared with 5 in 2015. Well, we've heard about Hillary Clinton's plan, which is maintaining the Affordable Care Act and supplementing it with a public health care option, letting more people into public options such as Medicare, expanding Medicaid. So basically, it would be moving towards more of a public option the way Canada has, the way England and France do, and also placing more caps on out-of-pocket health costs, insurance premium increases, and prescription drug costs. This is going to make more insurance companies withdraw from Obamacare because they're not going to be able to make any money from it. But people are going to be driven more at both ends of the scale, the low-income end of the scale, and also bringing the age down for Medicare, driving people into more publicly provided health insurance. And President Obama was quoted on the campaign trail when he was asked about a public option that this, in fact, was the end game. He knew that Obamacare was not going to work, and it has not worked. It's unsustainable. And the end game was always to use it as a place marker and then replace it with a public option. And we can see this is what Mrs. Clinton would like to do. In contrast, Donald Trump would repeal the Affordable Care Act and replace it with more of a system of competition among different health insurance companies, similar in one sense to the way it was before the Affordable Care Act, but different in that if individuals had continuous coverage, then insurance companies would not be allowed to hold any pre-existing conditions against them. So once they were in the system, they would be able to stay in the system. And adding to that competition would be allowing the purchase of insurance across state lines so that people would be able to purchase the plans that were best for them. With repeal of the Affordable Care Act, companies would also be able to offer less expensive plans. One problem with Obamacare is not just that people are required to buy health insurance, but they're required to buy extremely expensive health insurance. People who don't have children still have to buy plans that include pediatric dental care. People who aren't going to have children have to buy a plan that includes maternity care. People who've never tried any drugs have to buy a plan that has drug abuse coverage. People who have no history or no family history of mental illness have to have a plan that includes that. You cannot just buy a plan where you pay for your routine expenses out of pocket and you are insured against major catastrophic events, such as falling off your bike in traffic. I use that example because I am a cyclist, and that's probably my biggest health risk is falling off my bike in traffic. And as I mentioned before, this is how most insurance runs. You are insured in your home against major events. You're insured in your car against major accidents. You don't pay your insurance company for changing your oil. And this kind of competition would bring the price down. We heard before from the RAND model, that Trump's plan would increase costs. And the Congressional Budget Office is on record as saying that rolling back, repealing Obamacare would lower the deficit, not raise the deficit. Adding a public plan would actually increase the deficit because there would be less competition. What's important in every industry is competition. We see this in healthcare also. Let's look at plastic surgery, which is not covered by health insurance. People pay out of pocket. Those prices have steadily declined. LASIK eye surgery, where people pay out of pocket, those prices have steadily declined. So we get declines when we allow companies to innovate. Think about the BlackBerry in 2001, which was big and heavy and expensive. Now people are carrying these light smartphones that are much less expensive and can do a lot more. We heard a bit about the politics. Well, Donald Trump's plan tracks pretty closely with Paul Ryan's Better Way plan, which has full repeal of the Affordable Care Act, expanding accessibility to health savings accounts, again, purchasing of insurance across state lines, funding for high insurance risk pools, turning Medicaid over to the states. Again, turning Medicaid over to the states, block granting it, as Donald Trump would do, would allow states to set up the plans that are best for them, to target aid towards their residents, the residents that need it most. There's no reason that a plan that works, a Medicaid plan in New York State, is the same one that is needed in Nevada or Alabama or North Dakota. And it would be much more efficient for states to have more control over all their plans. And in terms of the children's health insurance plan, it could be in some ways rolled into Medicaid. There isn't any reason why people should have to have a tax voucher if you're low income, a Medicaid plan, a CHIP program. Those could all be replaced with one tax credit for healthcare that could be used by anybody. This would bring health insurance back more in line with other insurance markets. You know, you're driving along, you hear Geico say, call me for a 15-minute quote to lower your auto insurance. You never hear any plan say, call me for a 15-minute quote to lower your health insurance. You hear ads about life insurance. You should buy term life insurance. You know, people are not required to buy any life insurance, but they buy it because they think it's a good deal. It should be exactly the same with health insurance, and Donald Trump would use principles of competition to return health insurance to its role. So, anyway, to tie up, I want to thank you so much for inviting me to speak. And just to conclude, I'd like to say Obamacare is in terrible shape. It cannot be fixed by more tax dollars or more of a public option. It needs to be returned so it operates more like your auto insurance, your life insurance, your home insurance. And that is what Donald Trump would try to do. And since this meshes with what has been proposed by Paul Ryan, it would not be politically difficult to get through. Thank you very much.
Thank you so much, Diana. We're going to open this up now to our audience. This is your chance to ask questions. So please go into your control panel and you can type a question, and I will be pulling from those and asking your questions of our speakers. Should you be having problems with our control panel, you can also try Twitter. Our hashtag is HealthDebate16. So I'm going to start out with a question for all the panelists from Jane Sarasan Khan, who says, today Gallup published a poll showing that a majority of Americans would support a single-payer health plan, 7 in 10 Democrats and 4 in 10 Republicans. Would the panelists react to this finding?
Sure, I can start off. This is Jen. So I guess I'm a little skeptical of that kind of finding, just because most conservatives, and I think even some independents, are pretty skeptical of government control of anything related to healthcare. It got so demonized in 2009 as long wait lines and Canadian healthcare and British healthcare and all that. There was an effort in 2009 among Democrats to add a public option, which of course is different than single payer, to the ACA, and it never got through because even among Democrats, it wouldn't have passed. So I guess I'm skeptical of a public option or single payer happening anytime in the near future, although there is an argument that the exchanges and the fragile state of the exchanges right now is a sign that a single payer or public option is the only way, the only sustainable healthcare system. So I guess maybe further down the road that's more politically palatable, but right now it's just politically, I would say, impossible in the next year or two.
This is Sarah Collins. I'll just respond briefly to that. There is some states under the Affordable Care Act, states can apply for what are known as 1332 waivers and can pursue different approaches to the Affordable Care Act, looking at different ways of providing subsidized health insurance other than the exchanges. Vermont has looked at a single-payer health plan. So there may be efforts in states along those lines that they're able to find an efficient, affordable way of pursuing such a policy.
Yeah, I'd like to say that it really depends on how the question is asked. If you were to say, for example, would you like a single payer plan, people might say yes. If you ask a question such as, do you need to be able to keep all your doctors in your new plan, people would also say yes. They might not realize that under a single payer plan, they would not necessarily be able to keep their doctors. And we've seen before that keeping your doctor is very, very important to many Americans. So it just depends on how the poll question is asked. As we've seen from the presidential polls now, polls can be all over the map depending on how the question is asked. And people do want to be able to keep their own doctors. They want it to be affordable, and only competition can deliver those results.
Thank you. We have a question from Ray Lewis, who says, mental health and substance abuse care will be a key part of addressing the opioid crisis in the U.S. Given the changing responsibility from legal criminal justice to medical social service, are sufficient resources going to be available where and when needed?
This is Sarah. I'll take part of that. As I mentioned, I didn't cover all the candidates' proposals for health care, and Hillary Clinton actually has a large number of proposals on the mental health side, and Donald Trump addresses it somewhat more broadly. So I think both candidates have this in their eyesight as an important area for the country to work on.
This is Diana. It's extremely important to have facilities available, and this is a crisis. The opioid crisis is important. We need to be trying to stop these drugs getting into the country. We need to address the underlying causes. We need to raise the labor force participation rate through more economic growth, so there are fewer people just at home tempted to take these substances. But it should not be a required part of health insurance. If someone wants to purchase a bare-bones health insurance plan that just has catastrophic costs, like they can purchase a bare-bones home insurance or auto insurance plan, they should be able to do that.
And this is Jen. I'm just going to add on to what Sarah and Diana have said, is that there was a bill in Congress that passed a couple months ago, CARA, the Comprehensive Addiction Recovery Act, I think, that tried to lay out some ways to deal with the opioid crisis. There was a little bit of funding added to that, but Democrats in particular said that was not enough funding, that this we need to put a lot of money toward this, and that didn't ultimately pass, but I think that's something to watch for in the lame duck session. I think either Democrats or Republicans might try to add some money to opioid response, and I think certainly next year we might see we might see some interest in this. I think the problem is how to pay for it, and that's been controversial.
Thanks. We have a question for Diana from Richard Kirkner. He says Trump has said he wants people with pre-existing conditions to be able to purchase health insurance, but hasn't provided specifics. Ryan's Better Way is silent on this. Where does coverage for pre-existing conditions fit in the ideas that Trump and Ryan have floated?
So here's how it works. If you are insured already, then an insurance company, even if you want to change insurance companies, is not allowed to say you have a pre-existing condition, therefore I will not insure you. Say, for example, you get to the age of you've been insured continuously and you develop diabetes. Since you have been insured continuously, a company is not allowed to say you have diabetes, therefore I am not insuring you. There are people who are born with particularly expensive conditions, and the federal government would contribute to risk pools to insure those individuals, so they would be taken off the general market and they would not raise the premiums of everybody else. So there would be two types of people, and both of them would be insured.
This is Sarah. If I could just add a comment to that. In terms of replacing the pre-existing condition regulation in the Affordable Care Act with this continuous coverage requirement, some research that Pam Short did a few years ago showed that about 89 million people in the United States over a 4-year period spent at least 1 month without insurance coverage. So it's really hard for people to maintain continuous coverage. We know there's a lot of movement in and out of health insurance coverage. So it's likely that a lot of people would end up without coverage and then be subject to higher ratings. And the risk pool option, we really did see a natural experiment with the high risk pools with the Affordable Care Act's pre-existing condition plan. It was very expensive to operate. More people wanted it than could come in. The premiums weren't high enough to actually cover all the costs of the people in the program. So I think the experience with both those options, at least the high risk pool options, leaves a question about whether it would be an efficient replacement for the pre-existing clause in the Affordable Care Act.
Well, if you dropped 1 month, that would still count as continuous coverage. It would be something like 3 to 6 months. Everybody understands that sometimes you are in between jobs. But the important thing is that now, with the Affordable Care Act, people cannot enroll and pay the fine until they are sick, and then jump in and get the insurance. Then when they are cured, when they're better, they don't have to enroll again. This is immense what we call moral hazard in economics. It means that people can just take advantage of the system. And that's actually one reason why that's one reason why premiums have gone up so much, because you get the primarily sick people signing up.
Actually, people can only really enroll during the open enrollment period.
Well, they can enroll during open enrollment and then, for example, have some surgeries or something like that, and then they can be not enrolled the year after, for example, or they can drop the coverage once they have had those surgeries.
So we have a question from John James, who says, it seems to me that it is impossible for the average citizen to wisely purchase health insurance. The idea of competition among insurers could be little more than a roll of the dice for many people. It is not like buying homeowner insurance. Is this a concern?
I would say that Americans are smarter than that. They manage to purchase other kinds of insurance. They can purchase auto insurance, home insurance, life insurance, which many of these insurances are not necessarily required, or they purchase them in larger amounts than are required. And the Affordable Care exchanges have gone through immense trouble to make comparisons. If you look at the way Americans buy airline tickets, there are private sites such as Priceline and Kayak that lay out prices of tickets, airline tickets, depending on when you want to go. I think it's certainly possible for Americans, if they can operate Kayak, if they can buy life insurance for them also to be able to make the decision as to what kind of health insurance they want to buy.
This is Sarah. Just go ahead. Just jumping in, the Affordable Care Act has actually standardized the benefit package. So requiring all health insurers to offer the same benefit package has at least made that choice, that comparison, very easy for consumers. There is still considerable variation in premiums and deductibles, which does complicate the decision-making process for consumers.
Just as there is with other kinds of insurance, but Americans seem to be able to manage to purchase those.
This is Jen. I would just add, after talking to people who have enrolled in ACA plans, I think particularly in the first year there was a lot of confusion, particularly because networks weren't fully laid out in the online portals. So people would sign up for a plan and not realize their, such and such doctor wasn't included. There was also a lot of people who, just hadn't bought insurance before, so they didn't realize premiums, deductibles. And this all is, relatively complicated stuff. I'd say it's a little different than homeowners insurance, just because you don't, in best case scenario, you don't use that very often, whereas your health insurance you do use, even if it's just once a year. So I think that's gotten better as people have gotten familiar with the insurance coverage over the last 4 years, and I think the healthcare.gov and the state websites have gotten a little bit better. But I do think, yes, it is confusing. It's confusing and it's frustrating to people, and I think that has contributed, frankly, to some of the people who don't view their insurance coverage as great because they didn't understand it or they didn't realize how expensive their deductible would be.
Well, I think that I am old enough to remember life before the Affordable Care Act. And President Obama did say, if you like your plan, you can keep it. If you like your doctor, you can keep it. He went around the country saying that because he knew that people had plans that they liked. Before the Affordable Care Act, people signed up for insurance. They liked their plans. And the Affordable Care Act was sold on the basis that they can then keep their plans. So it seems a little bit strange to say now, after 2 or 3 years of the Affordable Care Act, people are no longer going to be able to choose the plans they like. They could do it before, and they would be able to do it again.
Yeah, and actually, just to follow up on that comment, most people have kept their health insurance plans since the Affordable Care Act passed. About 154 million people have health insurance through an employer. That has stayed about the same over the 6 years of the Affordable Care Act. So most people actually do have the same plans they had prior to the Affordable Care Act passing.
Yes, but many of those plans have changed because they have to become compliant with the Affordable Care Act in order to stay in business. Say, for example, the plan from my employer, the Manhattan Institute. Yes, it's the same plan, but the cost has gone up because they have had to add all these different bells and whistles to make it compliant with Obamacare. So the plan might have the same name, but it is more expensive and it has different characteristics. In fact, afterwards, President Obama went around saying, the plan you had before wasn't any good. It was a poor plan. We are making insurance companies provide better plans. Whether it's better or worse is a matter of judgment. I would say it's worse because it's more expensive, but he definitely admitted that these plans have changed.
Actually, we just released a report at the Commonwealth Fund that showed that the average premium in employer-based health plans on an average annual basis has actually declined in cost since the Affordable Care Act passed. So those provisions, such as allowing young adults to stay on their parents' policy, actually have not led to an increase in premiums on average.
I got to get our Human Resources Department to call you. I got to get our Human Resources Department to call you so they can get one of those cheaper plans.
Questions in. Beverly Gosage says, in Kansas, we looked at the waivers and found that there is really no flexibility to return to the high level of competition and low premium options that we had before the ACA. Will Trump's plan return regulation back to each state to fix any issues that they may have seen in their private marketplace?
Yes. When elected, Donald Trump will allow states to approve the plans that they want to approve. So state insurance commissioners will be able to approve a wide variety of plans if they choose to do so. It would be up to each state.
Did anyone else want to comment on that one? So we have a question from Sheldon Weisgrau. He asks about high-risk pools, which are designed to offer coverage for sick people who would otherwise be denied coverage for having a pre-existing condition. And these plans have this idea has long been floated by Paul Ryan and other Republicans, and more recently, Donald Trump added it to his platform. So the question from Sheldon is, haven't high-risk pools been used before and failed? How can we get government to adequately finance them?
I'll take that. The Commonwealth Fund has sponsored quite a bit of research on high-risk pools and also tracked pretty carefully the Affordable Care Act's pre-existing condition insurance plan. And the biggest flaw in high-risk pools is that you are dividing up the insurance market and putting people who with very serious health problems into one market, into one pool, and that becomes a very expensive pool by definition. So the state-based high-risk pools that existed before the Affordable Care Act charged on average premiums of up to 250% of those charged to healthy beneficiaries in the individual insurance market, but the revenues only covered about 53% on average of the program costs. So they're just a very expensive option approach to insuring people, and it just has been proven over and over again not to be very efficient or work very well for people.
Well, I would say that there are two options. One is allowing people who have particularly high costs of care, let's say those with hemophilia, for example, into the main healthcare system. And that would result in higher costs for everybody else. The other way is just to say, okay, we are going to bite the bullet and somehow subsidize the healthcare for these individuals. It could be done in a variety of ways, by asking insurance companies to submit bids to cover these individuals or provide them with some supplemental help. But many people have concluded that the amount of people with these serious pre-existing conditions is relatively small, and it would help the functioning of the entire market if they were afforded special treatment.
So I'm going to close with a question for all of you, but maybe I'll start with Diana, which is, with a Hillary victory, what is the likelihood of Republicans cooperating on ACA fixes next year, and how might that play out?
Well, as we said in the beginning, Paul Ryan is going to be very highly likely to be Speaker, and should Hillary Clinton win the election, and I think it's likely that Donald Trump will win the election, but should Hillary Clinton win the election, then she would have to cooperate with Paul Ryan, because fixes do have to go through the House, also with Senator Mitch McConnell, the majority leader. So those would have to be decided politically between the three of them.
And this is Jen. I can jump on that as well. I guess I think I spoke a little bit about this. I'm just very skeptical because, if Republicans, at least if they control one house of Congress, let alone if they are able to keep the Senate, I think they just see very few incentives to at least do the Democrats' repairs to the ACA. Of course, Republicans would do their own repairs to the ACA. But, Republicans have been arguing that this law is a bad idea from the start, so I guess I just don't see why they would change their tune now. I do think Hillary Clinton is better at working with Congress than President Obama was. After the ACA passed, Obama seemed to kind of, he wasn't one to have members of Congress over for dinner and go golfing with them. He didn't do that kind of face-to-face lobbying, face-to-face relationships that Bill Clinton was good at, Hillary was good at when she was in the Senate, and a lot of other presidents have been. So if she's able to build some relationships, maybe she can get Paul Ryan and Mitch McConnell to work with her, but then we have the Freedom Caucus, the very conservative House members who would, need to go along with this as well, and getting them on board would be even more difficult. So I guess I'm just You know, if you're thinking about an individual Republican member of Congress, why would they do something to quote unquote save Obamacare when they thought this was a bad idea from the very beginning?
Sarah, did you have any additional comments?
I guess I would just, comment in general just on what we've seen over the past 6 years in terms of what the Affordable Care Act has achieved. 20 million fewer people uninsured, falling out-of-pocket costs on the part of consumers. So, I really think that universal coverage really is integral to a high-quality, affordable healthcare system. And for the first time, we do have a viable structure to achieve this in the framework of the law. But achieving it is going to require commitment and very hard work from policymakers, and the ability and the willingness to reach across the aisle and work on the Affordable Care Act as it continues to evolve in the years to come.
Well, I would like to thank all three of our panelists for their time and their insights, and to thank all of you for participating. We're about to end our webinar. I want to just mention that an archived copy of this will be available later today on our website, centerforhealthjournalism.org, and we'll be sending you a brief questionnaire to find out your perspectives on this webinar and your ideas for future ones. Please take a moment to reply, as it helps us design the programs that we offer to you. Thank you again to everybody, and with that, we'll say goodbye.